Good morning, everyone. My name is Dr. Dick Walker, and this is my monthly Saturday morning chat interview, whatever you want to call it, with another healthcare professional. This morning is Dr. Rich Michal. Just a little bit on me. I've been an internist for more years than I want to remember, also an emergency physician. Also, I have a master's degree in preventive medicine and environmental health. And I would say that I'm an integrative physician. I'm now retired and a full-time ASEA associate, recommending this technology and explaining it to people around the world. And this morning I've got Dr. Michal, and I'm going to let Dr. Michal introduce himself because he knows more about himself than anybody else. And I think we're going to have some fun here, and hopefully you'll learn some interesting things if you're a healthcare professional, or even if you're just listening in to see what we talk about when it comes to Redox. So, Rich, tell us a little bit about yourself.
Yeah, thanks, Dick. It's a pleasure to join you this morning. And I'm Dr. Rich Michal. I practice in Rocky Mount, North Carolina. So if you fly into Raleigh-Durham and you drive about an hour due east on I-95, that's where I'm located geographically. I'm bilingual. I didn't grow up in the South. I grew up north, so I can speak Northern and Southern for those on the call. And so at any rate, but I'm very unusual in that I did my training at Chapel Hill undergraduate, BS in zoology, then went to change one shade of blue for another. I actually went to the Enemy Institution, Duke, did my medical training there, and then did my 3-year residency in family medicine up in Newport News, Virginia. Decided that time that I wanted to integrate my faith into my practice. So started looking around. There wasn't really anything going on. Believe it or not, for some on this call, there was no internet at one point in time, and I lived in that point of time. And so networking was a little bit more archaic, perhaps. And I decided, hey, if I wanted to do that, I probably had to set up my own shop. So that's exactly what I did. Started a practice, and in a very unusual way, I've been in this town for over 37 years, and founded the practice. It was traditional family medicine. We didn't do obstetrics, but we did everything, soup to nuts other than that. And it's been a very, very rewarding career, very satisfying. But, medicine has changed over the years. It's gotten a lot more intense. Enter electronic health records. They're blessings, but they're also a lot of paperwork has ensued. And quite honestly, a need to see more and more patients, a need to be cognizant of the time in the room, just all of those parameters that are really constraining traditional medical care now. And, quite honestly, Dick, I was getting worn out. I was burning out, 14-hour days, 6-7 days a week. It was getting to be onerous. And fortunately, some options came open for me, and I'm now 1 year into a concierge type practice. I spend 30-minute follow-ups with my patients. We can engage in lifestyle change. It's awesome. We were talking before the start of the seminar how, when a doc has time, in any professional, when you have time on your side and you have time with whoever you're interacting with, that's precious. You cannot, that's an element in what we do. And when you take that time away, it hurts the relationship with the doctor, hurts the relationship with the patient. Nobody is really satisfied at the end of the day. So this has been a breath of fresh air for me. But, so now I'm doing that concierge type of practice and loving it. One part that your listeners need to be aware of is that you're very special to me, Dick, because when I first heard about this, Dick was on a 3-way Zoom. and they brought in the heavy hitter guy. And when he mentioned Redox, folks, I didn't know what he was talking about. We can get into that a little later, but at any rate, I'm married, have 4 kids. Just saw some of my grandkids, made pancakes for them this morning. And we have 13 grandkids. So I have an interest in astronomy, and I personally love working out. And after this Zoom, I'm going to go and work out. So that's a little bit about me.
Great. We'll have to have you visit us. We've got beautiful clear skies here, especially in the wintertime. If you want to bring a telescope or whatever, it's probably a great place to do some stargazing. But I didn't know that until this morning that you were a pancake, quick order chef. So maybe when you come out here, you can dazzle us with your pancake recipe. But how did you first become aware of redox and ASEA, and how did that all come down? I think people watching are always interested in how a doctor is first introduced to this, and kind of why does he, kind of get excited about it. So,
yeah, I mean, it's a great question, and for your audience who are not physicians, to go in through to explain this again, in 14-hour days, busy, most physicians, and for that matter, most health professionals, nursing staff, they're worked to the bone. And the extenders as well. It's just happening throughout the profession itself. But to get to my personal story, busy. I really, I'm more a lifestyle guy. So if it's not a prescription, then it was a lifestyle, and looking at how that can work hand in hand with prescriptions. But in terms of supplements, I just wasn't there. And honestly, I just didn't have time to go into looking at this supplement, that supplement, this company, that company. And that's where I was. Life happens, though, to every one of us. And life happened about 3.5 years ago. And it was 2 days after Christmas. We had the family in for a family get together. And I got a phone call from my daughter, who lives a little over an hour away. And she started to describe, at that time he was 13 years old, Gideon. And she started to describe some of his symptoms that morning. I was just getting ready to start with my first patient. And Dick, this in medicine, sometimes you need a big, long, lengthy explanation of lots of symptoms, and you're going down all sorts of little rabbit trails. Well, within about 2 or 3 sentences of this boy's symptoms, I said, honey, you're hard to find. It's easier for you to get him in the car right now, take him to the pediatric emergency room rather than the rescue squad to find you. She did that. Within 2 hours of being in the emergency room, they transferred him to Duke, my alma mater. He spent 5 weeks there. And as any professional on this call would know, you do not want to be the star patient at a university teaching hospital. You just do not want to be that patient, because everybody's trying to figure out what you have. They're trying to one-upsmanship each other. And honestly, in a good way, because they realize nobody can figure out this patient, but I'm going to do it. And I participated in the rounds on the weekends. I asked to be part of the rounding team, to listen to them. And honestly, the best and the brightest minds were on this case. They went out to their house, did soil samples, everything. Mm. And at the end of the day, they didn't have any clue. He had major neurologic impairments. Honestly, folks, it's almost like an adult who goes through like a stroke type of situation, and they have impairments. They might not be able to speak. They might have difficulties swallowing food. They might have difficulties ambulating. Well, that was him at age 13.
Well,
And honestly, they had no answers for the cause nor for any treatments. And he went through rehab, 2 weeks of rehab, and then he went home. And you can imagine there was a lot of changes that had to be made in this case. And because traditional medicine had no answers, they went to outside of traditional medicine. They were spending thousands of dollars on all sorts of alternative options. Nothing was working for him. And finally, through how ASEA works, which is one person telling another person telling another person, because you're not going to find it on TV, you're not going to find it in any newspaper articles, radio, any of that. But through one person telling another person, and God's providential hand in all of this, ASEA found them and they started using it. And honestly, within about a month, there were major changes in this kid's manifestations and his limitations. And so when you have folks, when they have this family, there are now 10 kids in this family. Okay. When you have a lot of kids in a family, there's bound to be a birthday at some point. And pick any month and you're bound to have a birthday. Well, what had happened was I didn't know all this was happening behind the scenes, but we were going to go to their house for a birthday celebration. And I remember Anna saying, Dad, something's helping Gideon. And I said, really? Wow. And she said, we're going to have the birthday party and all the regular stuff, but do you mind hearing about it? And I said, well, why would I mind hearing about it if it's helping him? So we had that meeting with Ed and Rebecca and Paula and Fred, and Dick Walker. Dr. Dick Walker was on the Zoom call. And I will remember that I did not really have any kind of scientific founding on redox. I mean, my medical training way back years ago, even at Duke, the literature that we knew about redox was in just teeny, tiny, and we just didn't think much about it. It was just not what it is now. So I didn't want anybody to ask me because I knew they're going to say, hey, Dad, what do you think about this? And I sunk into that sofa real deep. But I will say, behind me is a series of textbooks. And I went out because I knew Dick that it was helping my grandson. I knew traditional medicine had no answers for him. So they were really forced to look at something different. This was absolutely changing his life story. And even some of the other grandkids as well. So I had to look at this. I couldn't look away. But because of my profession, I wanted to look a little deeper. And I wanted to try to figure this thing out. What is this redox? So honestly, life happens. And that's what running into that brick wall, so to speak, is what forced me to look at this.
I think that's true for a lot of us healthcare professionals or just anybody. They probably wouldn't take a look at this except that somebody that they know and care about has a significant breakthrough in their health because of this. But I was a few years ahead of you in terms of finding out about redox, looking at redox. And I know when I first, and it was to be 9 years in October, when I first kind of signed on with this technology. And back then there just wasn't a whole lot of information available. When I would go to pubmed.gov, I remember to this day, there were a little more than 600 references. Now in that database, there's close to 40,000 or more references. So that explains the explosion of information that we've had. But I still realize that from talking to a couple of people that I met at a gathering where ASEA was introduced, that I looked them in the eye and I said, "What's going on here?" And it was obvious that they'd had very significant positive changes in their health just from drinking this stuff. And I wanted to know more. And I do remember that that webinar that we did with you a few years back and you were like almost dumbfounded, like, what is this stuff? I've never heard about it. In fact, as medical students, we sort of, took the test on mitochondria and how they work and the Krebs cycle. And then we just said, boy, I'm glad I'm never going to have to deal with that again. And some 40 years later, we're having to deal with that again if we want to understand this technology a little bit. You certainly don't have to understand that to use it or to recommend it, but the science, I think an important thing to note is that the science is there. So, so what have you done over the years in the beginning and just kind of briefly to validate in your head that this is real, that this is different than vitamin C, this is different than any other, quotes, nutritional supplement, end quotes, in the marketplace. It is just a whole different ball game. What have you done to validate that, to get a really good feeling about when you're recommending this to somebody?
Sure. Well, I think one point you just made is so true. Coming in and being exposed to this in just the last few years, for me, it's like coming in and seeing an athletic talent that was in the rough when you came in, but now all of a sudden, this athletic talent has gone through the minor leagues. They've learned techniques. There's been coaching. There's been training, and now all of a sudden you're getting this amazing athlete that's capable of all these different applications, but it maybe didn't start out that way. And I think the journey for us who are in the health professions and even not in the health professions, this is a maturing field of endeavor. And for instance, the genetic study that was done by ASEA, to me, is absolutely astounding. Now, that wasn't there when you started your journey, but it is for me. And when I looked at that, I thought, this is absolutely amazing, because this is working at a genetic level, which is astounding. And it works within 8 weeks of ingesting the liquid, and it's upregulating genes that have actually some very important pathways. And it was compelling enough that the company is actually able to put those kind of major themes, if you will, on their labeling in the United States, which is truly amazing, because this is a supplement, folks. It is not a pharmaceutical agent, so it's not intended to cure, diagnose, treat, prevent any diseases per se. But I will tell you, I've seen that occur, and it's just an amazing thing. So the genetic study, to me, a lot of people that utilize this product will say, well, I sleep better. But if you look at some of the pathways that this is involved in genetically, it all of a sudden starts to make sense. We start to connect dots. Folks, again, the health professionals, just hang with me. I know you know this, but there's a term called basic science research. It's kind of lab-based. It's using animal studies. It's in petri dishes. It's maybe not necessarily human application. It can be, but it's basic sciences. But then there's a thing called translational science. It's where we take this basic information and we translate it into human pathophysiology. We actually look for those applications and see how does this basic science now connect in quote, what many would say is the real world, okay? And the real world of our well-being every day. I think, Dick, what's happening is we're going to start to connect more and more of those dots. I think for me, the fascinating thing, and this is for anybody in the audience, listening audience, PubMed, Google Scholar, not Google, okay? Google Scholar. It's fascinating to just take a term called just redox biochemistry, for instance. and then put in whatever term you want to search, whether it's heart or kidney or liver or brain, or, since we're talking about a research engine, you could put in a disease process if you want to, just to see how big this explosion that Dr. Walker mentioned just a moment ago, how big this thing is just ballooning. If I was a grad student involved in the healthcare professions, and I wanted to go after a Nobel Prize and work in a lab that could go after a Nobel Prize, I mean, something with redox would be it, something in the redox field. So literally, there's all this basic science stuff that's coming out now. And the intriguing thing for me is that to look at, well, do we have anything in that area right now? Let's make those assumptions that this is extremely important and that the basic science is supporting this. Well, all of a sudden now we've got a company that is the leader of cellular health in the world, and honestly, their flagship products are dealing with what? Redox biochemistry, and to have that genetic study, and the company is putting money and resources into further trying to unravel these connections and to see what does this redox actually do in quote real life. And I think it's just fascinating.
Yeah, no kidding. I've been fascinated with it for almost 9 years now. It's what you touched upon there is, ASEA has a product that is not only breakthrough product, but it is the only product in a breakthrough technology. And to some degree, that's a blessing, but to some degree, it's a curse because nobody knows about it. So when you start talking to people, it's like, deer in a headlight, especially professionals who have never heard the term redox or redox signaling in their training because it's only recently been integrated into the medical curriculum. And yet we've got it, and it's the only ball game in town. No other entity has been able to figure out how to develop a way to supplement these. And you're right, you've got to connect the dots. And in fact, for any healthcare professional that's listening to this, or anybody who wants to understand that aspect of it a little bit more, on the first Saturday of every month, that's exactly what I do. I talk about the basic science of redox, and then I go through that gene study and pull up some examples of studies and basic research things out of PubMed that relate directly to why it helps certain conditions like cardiovascular and hormonal and the whole gamut, and it really starts helping people connect those dots. That here's the basic science, and here's what we know about redox, because in the beginning, we didn't have much that really proved, we know that redox is important. It's the foundation of life almost for the biochemistry of our cells. And yet we didn't really have any understanding of what happens when you give the body extra redox molecules. Does it use them? Does it need them? Does it benefit us? And now we have certainly enough science to show that it does, not an overwhelming amount, because this is new technology and research is unbelievably expensive, but ASEA is starting to put a lot more effort there. So I'm going to ask you a question that people often ask me, because I want to see how you're going to answer that, and is, why would a successful physician really, to a little bit of a degree, go out on a limb to represent this technology and start to recommend it to people? And why would you do that? It's a breakthrough technology. It's very interesting, but what was it that got you to do anything more than to tell your grandson, I'm grateful that you found an answer, really cool, keep using it? Because that's oftentimes the answer people get when they ask their doctor, what do you think about redox? It's done this for me. And the answer is, well, that's great. I don't understand it, but keep using it. What made you take that next step into promoting it to some degree?
Well, it has to do with a basic approach that I've had for years. As I said earlier, I wasn't into supplements, but that didn't mean all non-pharmacologic interventions. You know, I want everybody on this call to imagine you're in a canoe, and you're in the canoe with me and yourself, and we see across the river, we see exactly the landing spot we need to get to. And so I'm on the right side of the canoe, you're on the left side of the canoe. We both have a paddle, and there's a current, but it's not a crazy current, but we have to paddle across the river. And if I'm the only one paddling, we're going to go in a big circle. If you're the only one paddling, we might go in a big circle. But if we are both paddling together, one may stroke a little harder than the other, but we're going to get there eventually. We may zigzag a little bit, but we're going to eventually get to our destination. And folks, everybody, I would say just about everybody on this call is probably interested in your own personal health, well-being, how much you're aging. And we were talking earlier about, gee whiz, it's not just our aging process, which we think Redox plays a critical role in, but it's also the external things. Some of y'all may not think pancakes are all that healthy. I tried my best, but I did throw some blueberries and some bananas, but then there was some chocolate chip things in there, some butterscotch things in there. So maybe I wasn't making maybe I wasn't making the healthiest pancakes, but at any rate, we have external forces that they're getting after us, that are challenging our bodies. But again, getting back to this concept of the canoe and the paddles, I've always felt that lifestyle is important, but now all of a sudden, I'm open to this new realm of biochemistry. And I'm starting to see how, critical this is, and I don't have anything to address it. Well, all of a sudden, here's this product. Oh, gee whiz. Well, it's involved in redox. It's not toxic. Oh, and by the way, it doesn't interact with any medications. It's in and out. It does its job in well under seconds. Okay. So I don't have to worry about drug-drug interactions. Gee whiz, this is a wonderful thing that you don't have to be, and you don't want to really have to be a physician, because it's not a pharmacologic agent. And folks, nowadays, I have a lot of folks, and I have time to talk to my patients, which is wonderful. And when I ask them, are you scared about using medicines? There is trepidation, because people understand, when you hear about these medicines on TV, they spend more time talking about the side effect profiles and beware of this and beware of that, and they have to. And drug interactions and all of that. And there's a trepidation, there's a healthy respect. And in some circles, there's like, doc, do I have to go on that pill? And to be able to now offer people a substantial, non-toxic alternative that is not a pharmacologic agent is wonderful. All of a sudden now I feel like I can row with this paddle, that side of the canoe. Boy, maybe it's been a little tough. When I ask people to do lifestyle intervention, that's tough. No question about it, but we can still work on that side. As wonderful as Redox is, as wonderful as ASEA is, I tell folks, it doesn't tie your sneaker shoelaces for you. So, we have a responsibility to do the best help that we can. But getting back again to your question, Dick, is I see this as a augmentation of non-pharmacologic possibilities for everybody out there. And because it touches a basic biochemistry in so many different ways, and it can, every cell in the body can actually benefit potentially from this technology.
Yeah, it's fascinating. You touched upon aging. And, I'm 73 now, so I'm very interested in slowing down that process. And, the concept is starting to gain traction out there in the healthcare community that, we focus on individual diseases like cancer and heart disease and all those different things, and we put them in different boxes. But in actuality, the greatest risk factor for almost all of those serious chronic and degenerative diseases is aging. And I don't know of anything else out there that can alter the sort of inexorable problem that presents. But you want to comment on maybe how you look at ASEA and aging, and when you're talking to your clients that are starting in, maybe entering the second half of their life, and in addition, lifestyle is so important. You can't be a couch potato and eat junk food and take ASEA and think that that's all you need to do. So lifestyle is hugely important. But you want to address how important Redox is there?
Sure. Again, there's a couple of concepts to maybe try to answer that question. One is simply, as we said, all organs are made of cells, and cells are all based on basically at a root level. Redox biochemistry is a root level commonality. And, this concept that as we age, after, and it's a little debatable about when we max our own production of redox within our bodies. We're making redox within our bodies, but at what point do we max? It's probably fairly early in life. You could throw out some things, pre-adolescent, but for every decade thereafter, we're dropping about 10%, and that's probably in best case scenarios. Best case scenarios. So as we age, we're developing this area under the curve. It's a concept of something happening repeatedly, but it's happening over long periods of time that we're getting into this deficit state. And I think one of the easiest ways for lay people to even understand this concept is to just look at the aging of the skin. It's the largest organ by body surface. And so, you just look at that, and someone may fool you, but you start to look at the hands, you look at other pieces of the skin anatomy, and you can start to maybe pigeonhole where somebody is age-wise. Well, the studies using Redox, and the ASEA company has a stabilized Redox formulation for topical use. And it's absolutely amazing. I will never forget an opportunity to share with somebody. And I said, you ought to use this. You ought to use this. And I saw them, I hope that they were going to be using it, saw them back a couple of months later. And at first I had to do a double take. I wasn't sure it was really them. And then as I got closer, I realized it was them. And they looked, and I'm telling you, this person was in their late 80s, early 90s. And it looked like a completely different person. And I actually asked her, are you wearing makeup today because we were going to be meeting? And she laughed. She said, no, this is just me. So, is it possible to overcome that area under the curve, that aging process? It is. Some of us have a lot more area under that curve than others, I would say. If we've not taken care of ourselves well, if we've allowed external stresses to enter into the picture, sure, it may take a little longer. That's why I always tell folks, and I do this with even pharmacology. It's so important for us to give realistic expectations, and I think that that's important. And, for somebody to hear, Well, I heard somebody, in 1 week, they had this amazing response. Well, that happens 15% of the time with this Redox technology. Well, that means it's a very small percentage at 1 week. At 1 month, it may be 50% of a major response that you would say, aha, this thing is working. At 2 months, it's maybe more like 75. At 3 months, it's more like 90%. But there are many, many things that we have to have we have challenges in that may even require a longer period of time. But I know that the genetic study said that in 8 weeks of continuous usage, 8 ounces a day, 5 genes are upregulated in an amazing way. And the sad part is it's not a long-lasting effect. It's not like an immunization. I get immunized and then I've got years of good stuff going on. Actually, people fall right back to their baseline. So it shows how important this technology is. I think we're just learning about it. And gosh, the applications for aging, you better believe I'm using it too.
So where do you think this is going in the future? There's a couple of things that I analogies that I draw with healthcare professionals. I say, look, if you've got complicated patients who, no matter what you're doing with what you know now, and they just aren't, that the path that they're following isn't changing. In fact, they're probably getting worse. They're certainly not turning things around. If you've got patients like that and you haven't corrected their redox, their underlying redox homeostasis, it's kind of like playing darts with a blindfold on. It's kind of like playing ping pong with your hands tied behind your back, or maybe just one hand tied, whatever. But it's really compromising your ability to help them and their ability to get better. And I'm sure you've seen that. Where do you think this is heading in the future, based on what and I know, and people like us who have engaged with this? Where do you think this is going? Everybody knows about antioxidants. Hardly anybody still has heard about redox, but where do you think this technology is headed? Where are we going to be 5 and 10 years from now?
Yeah, I think we are literally on the tip of a informational and life-changing tip of an iceberg. I really do believe that. Information technology is helpful in many ways in the sciences, and it accelerates things. And I think we're going to be on this accelerating curve. It's going to be quite a ride. You and I are both old enough to remember that when we started out our medical professions, the treatment of something is easy. People think about high blood pressure. The exams were really easy for us back then, Dick, because we only had a few categories of blood pressure medicines. I mean, literally, folks, we had 10 or 12 medicines you had to memorize and how they worked. And that was about it, really, for something as easy as blood pressure. Now there are dozens and dozens and dozens new classes of antihypertensives. Again, this is not a pharmacologic product, but I'm going to liken this to the explosion in that area. And I think we're going to have an explosion of realization of what this can do over time. I think we're going to have a better understanding of, again, how important that redox really plays in everyday health. I think it's going to be amazing. And like you said, I hope I'm around to just see more and more how this is being utilized. And I think for everybody on this call, I think the challenge is thankfully, you don't have to be a medical professional to talk to people about this. I saw my brother just yesterday, and he mentioned a family member who's having a tremendous health challenge in his wife's family, and he knows about redox. And he said, I think I'm going to recommend this for her because the medical professionals have expended all their bullets. There are no bullets left for what this lady is dealing with. And he said, do you think this could be of maybe value? And I said, what do you think? He nodded his head. And I said, you go for it. And if I can help in any way, to talk to her, to allay any fear she has, whatever, because, so it's amazing. I think it's an amazing place to be right now, to be honest.
Yeah, I would absolutely agree with you. It's interesting you brought up hypertension. I do want to get our official disclaimer in here that ASEA doesn't cure, heal, or treat anything. What it does is gives the body a tool that's foundational to cellular health, and then let the body take it from there and do what it's capable of doing. But I used to have fairly significant hypertension. I used to be on 4 different hypertensive drugs, and you might say that it's just serendipity or coincidence, but 4 years after I started drinking 8 ounces of ASEA a day, my blood pressure was way too low, and I've been off of those medications now for a number of years, and my blood pressure is still just absolutely in the normal range. So I don't know how to explain that any other way than this gave my body a tool that it could use to improve my cellular health, my underlying foundational health of my cardiovascular system, and now negated the necessity to take all of those medications, which all had certain side effects associated, or risks anyway, associated with it. So we're getting a little bit long on time here, but one or two quick questions here to wrap this up. The response that your grandchild had is just amazing. You do want to share maybe one other fantastical, cool experience that you've witnessed in somebody that and may have influenced in one way or another to try this technology? Do you have a really blow it out of the park kind of experience you'd like to share?
No, sure. I mean, my daughter had the one who had the child with the major brain challenges. So, they had friends where they used to live up in Virginia. And she asked me, she told me about a situation, dear couple that they had known up there and in their church. And, it's an older couple, and he was starting to go through terrible, terrible changes with his memory and his thinking ability. And he was seeing good docs. The treatment for his disorder is really limited. I would put it in the same historical context as when I started out with the blood pressure issues. Very limited armamentarium. It's what we have. It is what it is. And Anna asked me to actually talk to this lady because he was using very good meds. He'd seen specialists for this issue, and yet he was basically, to put it in a nutshell, he would be at the table with her and look straight through her, as if she really wasn't there. Okay, and that was his level of interaction. Okay, so Anna asked me to talk to her just from a friend basis, and I remember it was. We were in town. They were going to be eating with us. They loved going at that time pre-COVID out to a restaurant where the kids could have at it, and a buffet. And I noticed she was out in the parking lot when I arrived, and she was talking. I said, "Oh, aren't you going inside?" She said, "No, Dad, this is the lady. You need to talk to this lady." Okay. I said, all right, let's talk. Well, I found out she was seeing the best. They had done the proper testing. He was on meds. He was having no improvements. Okay. And he was far along in this process. So I tried to reassure her. I said, don't stop what you're doing. Don't stop what you're doing, but you can feel free to use this as an adjunct and give it some time and see how it turns out. So my daughter gave me further follow-up. And within probably 4 weeks of using it, 4 to 5 weeks, he's doing crossword puzzles now at the table.
Wow.
And then another month or so passed by, and they had this little shtick that when he would drive, when they would be in the car, he'd pat her thigh when they were driving along. he hadn't done that in years. She would have to drive him to, doctor's appointments, etc. He was incapable of doing that. All of a sudden now he's patting her thigh again. And finally, I don't know what this guy did, but maybe it was 12 weeks into it. I think, I'm not sure if he was an engineer or something, but he kept logbooks of whatever he did vocationally. But they were stuffed into furniture and file cabinets and stuff. Well, somehow he got a hold of those things. And he joked with his wife. He said, "Honey, I think I used to do this, didn't I?" And she said, "Yes, you did." And he looked at her and he said, "I was quite good at this." And when the kids had to decide about continuing this, because there is a cost to it, there is a cost to it. The last I heard about this was that the son, who was kind of the lead on the kids, said, "How can we not stop this? Look at what it's given Mom. Dad is back for a while, and we're gonna continue to support this." So, folks, look, medical science, we had run out of our bullets. Here's another bullet that obviously did amazing things in this couple's life, and it really changed their landscape. And I've never met them. I probably will never meet them, but to play a role in like that means a lot.
Chokes you up, doesn't it?
Yeah.
Yeah, it's I can count on one hand in my conventional medical practice that I would get people saying thank you, what you recommended has changed my life. But that happens quite often when you're recommending the Redox, the SEO Redox treatment. So let's wrap this up. We're at about 45 minutes. Just kind of in closing, what would you, maybe there's some healthcare professionals on here that are just kind of looking at this, trying to decide what they're going to do, whether they're going to embrace this. What advice would you have for them to start their journey, or to take that first step, or get them wanting to take that first step? I think we've touched on a lot of that here, but if I called you up and said, Rich, I've got a healthcare professional, MD, whatever, DO, any variety of healthcare professional, well, I'd like you to talk to them. They're kind of looking at this, but they're kind of hesitant. What would you say to them?
Sure.
I had that conversation with you, years back, but
Yeah. If there's a personal why to it, it's always very helpful. If someone is tender, if they're going through a personal challenge, a family challenge, people are gonna be more receptive. There's no question about it. The science is helpful, but again, as we've mentioned on this call, the direct point-to-point science is coming. It is there. There are some elements of that. I would start with redox. Is redox biochemistry a foo-foo idea, or is it a real idea? Have them just look very, very briefly at the breadth of articles. If a person's specialty is cardiovascular or some other field of interest, if it's a family doctor, they have a broad perspective on things that interest them. First of all, is it a real science? Again, I was old enough that in my textbooks, this wasn't really science at that point. It's not something that we knew about. We hadn't investigated it. So that's an important element. I think understanding that there are personal stories, I think is helpful. The more anecdotal stories are anecdotal, but then they add up. And if they're in your own family and you realize this is not a placebo, this is something real. It's not something I can write a prescription for, but it's still something of importance. Those things are invaluable, I think. And, realize that medical professionals, again, as we said, we're overworked, we're strained out the wazoo. It's hard for us to take extra time to look at things. So, be pleasantly persistent, And life happens to all of us, and life happened to me. And if you had approached me 5 years earlier, I don't know that I would have really bought all these hundreds of dollars of textbooks at that point. So again, realize that that life happens. So in a nutshell, I think I would be pleasantly persistent. Point to the redox biochemistry itself. And if you're familiar with the genetic study, you can always talk about that or send them information about that.
Thank you very much. Well, let's wrap this up.
And one other thing, get them to Nashville.
Yeah, get them to a meeting where they can rub shoulders with a bunch of us and other healthcare professionals. And one of the best questions that you can ask anybody if you do get to the Nashville meeting is to ask them to tell you their personal story. What got them engaged in redox, what happened, why are they here? Why are they spending a couple of days in their life to learn more about this technology? But, I was just listening to a webinar the other day. It was an interview, and the concept that came out is that, in the early stages of our life, our resume is what's important. In the latter stages, it's really our legacy. And I just want to thank you for listening when I talked to you several years ago and really engaging in this, because you're part of my legacy. Because I don't know most of the people that you've introduced this to, and I probably never would meet them or have a chance to interact with them, but you have. And so you and I are creating a legacy of people that we've helped because of the way the business of ASEA Redox worked. And so if you want to start working on your legacy and the number of people that you have positively impacted through your influence over them, I would really strongly urge you to take a close look at what we're talking about here today. So just to summarize, you can, I just want to announce that if you want a deeper dive into the science, on the first Saturday of every month at 8 a.m. Pacific, I do a seminar on a deep dive into the technology and how it relates to the ASEA Redox. And anybody's welcome to come. It's at the same site as you accessed here today, discoverasea.com, 8 a.m. on the first Saturday. And then there'll be another guest next month on the third Saturday. And you can access this recording. Again, it's in the chat if you want to write it down, but www.vimeo.com/ASEA United. So thank you for attending today. And hopefully you've gained some information here that will help you personally, professionally, in talking about ASEA Redox and how we've become engaged with this as professionals. So thank you very much. And I forgot to mention the date. This is July 17th, 2021. Thank you.